had the flu jab while I was pregnant with Jasmine. She's my first baby. My main motivation for having it really was to protect her more than for me. I know that by having the vaccine, it will protect the baby for the first few months of life. And as you can see, she's a perfectly happy little girl, and it certainly worked. She was very well healthy while she was those first few months. I know as well that obviously I was giving her the best start in life, really. And so that was really why I had it. The last thing you want to worry about when you're a new mum is whether your baby's going to be healthy or not, and that just gave me one last thing to worry about. The flu jab's given to those that are at the highest risk from the complications of flu. So it's those that are over 65, the under 65s that have got a long-term condition, so things like diabetes, asthma. Pregnant women obviously are a key group, and then also we give it to health and social care workers because we don't want them spreading flu to patients as well.
There was one year where I didn't have the flu jab, and then I was off for 5 weeks with a really bad chest infection, ended up in hospital. So ever since then I've always made sure I've had that flu jab, because like I say, 5 weeks off work and not being very well and trying to look after a family, just not worth not having the jab, because it does get worse over the winter period, my asthma, so it does keep it at bay, and colds are a minimum then and don't go any further.
There's some national figures knocking around which estimate that the actual cost to the economy every year of winter flu is about £1.6 billion, which obviously in these tough economic times is a lot of money. You know, we need to be boosting productivity and ensuring that that money's in the economy, not taking it out. So, you know, business has got a key role to play in ensuring that their staff are fit and healthy and able to, you know, do the jobs properly and put that productivity back into the economy.
Flu can knock healthy people and even footballers off their feet for a couple of weeks, which can make it impossible to look after the kids, go to work and score goals. Getting a flu jab is your best defence, so don't put you or your family's health at risk this winter. Stay flu safe. Let's kick flu into touch this winter.
Well, the flu jab is very important. Pregnant women are at more increased risk of infections during pregnancy and more susceptible to various different problems, and flu's no exception. It's very important that the women do have the flu jab. It can have serious health complications for them, potential systemic infections which could eventually lead to intensive care unit. So obviously we want to try and minimise those risks as best possible.
I had the flu jab so that I couldn't catch flu and give it the baby so the baby would be safer. After the flu jab I felt absolutely fine. I didn't get any flu symptoms or anything. It's just better for you and the baby.
The flu vaccine is extremely safe and effective at what it does. The vaccination has been tested on thousands of people and millions of doses are given in the UK alone every year. So we know that it's safe, and we've got lots of experience about using the flu vaccination in the UK and around the world. The vaccination itself is tailor-made each year to suit the flu viruses that are around. So the vaccine will protect you against this winter's flu, and that's why it's really important that people have the flu vaccination every year.
We're holding 3 flu clinics today. Patients booked in every 3 minutes, and that really is for any patient that happens to be eligible. So that includes the over 65s and any under 65s who are in an at-risk group. For those patients who are over 65, feel fit and well, it's a nice sunny day, the weather isn't particularly bad, and they think the last thing on their mind is having a flu jab, I would still urge them to come in and get it while it's available. If you are fit and well one day, things can change very quickly, and there can be serious complications if you do catch flu. The flu clinic itself can be a social event. Come down, meet your friends, join other people in the waiting room. The flu jab is pretty much non-painful. You can get slight symptoms afterwards, but you don't get flu, which is a common myth, and it's well worth doing. The benefits far outweigh the risks.
You didn't have the jab last year?
No, I chickened out last year, but I think it's a good idea really to have it. Well, I didn't feel the injection at all, and I don't feel any effects now. Whether I'll be okay overnight, I don't know, but I hope I'll be okay.
The common myth really is that the flu vaccine can give you flu, and this is something that everybody always says, and actually that's physically impossible. The vaccine doesn't contain the whole virus, so it can't actually give you flu. Unfortunately, some people sometimes experience sort of mild side effects like aching muscles or a temperature, but that's not flu. That's basically the body's immune system working to the vaccine. So I definitely urge anybody, it's very safe, they can feel very confident in it. Hence, my own family and myself have it every year because I feel that confident in that vaccine.
Again, just a little scratch. And if you just wait 5 or 10 minutes in the waiting room in case you will.
Jane, you've had the flu jab this year. What made you have it?
Just because they sent a letter really and invited me in to come and do it, and I felt I should do it. Certainly nothing to be frightened of. No, nothing at all.
We've always worked. We need to work 7 days a week, and you've got to try and take precautions if you can.
I'm at the age where they send for us, and I've been coming for 7 years. It's never made me poorly, and it's always saved me from getting the flu, and I think it's a real good thing to have. And I think, we should be encouraged to have all these things that we're offered, because it does save you a lot of illness, and there's no pain, so it's great. Because if you got real flu, you would be very poorly. It's not a cold, it's really not nice. And I think to get this injection to stop you having that illness, then it's a good thing. You should all really have it.
Really, to sum up, flu is a highly contagious disease which people of any age can get, and for the vast majority of people it is a non-serious condition. But if you are over 65 and if you have a serious underlying condition, it can kill. So I urge you just to go and get your flu jab now.
I used to be a children's nurse, I've been a practice nurse, and I've been a nurse for over 10 years now. So I've seen people of all age groups experience the complications of flu. So I've seen firsthand how serious it can be. And that's really why I'm so passionate about this job, both in my profession and also in making sure my own family are immunised. It's something I very much strongly believe in, that I know is the best that we can do to help protect those that are very vulnerable.